don't want to create a tourniquet effect. And also that I'm not sure that you really need to. Just be careful of your hamstring tendons. And the other thing that's a little bit tricky is when the patient knows a little bit too much and they try and help. And you get that a lot, especially once they know what you're doing and what's coming next. They tend to start anticipating. It's like, you know, if you're manipulating a patient and they know what's coming next and they start getting themselves into position, just lie there, just lie there. Okay. So the medial collateral actually extends quite a long way above and below the joint line. So we really want to make sure that we're covering and supporting it over its entire length. And again, this is one of those techniques that is easier with big guys than little girls. And it should govern your selection of tape as well. So you can see I'm being quite careful not to drag the gastroc with me. I'm creating my anchor points. And as you probably noticed with Paul's stuff as well, I reckon giving yourself a really nice broad anchor point is really helpful. Alright, now at this point, if we were working with a big guy, I'd probably continue on with the 50mm, but because we're not, we're going to switch to the 38mm so we can fit everything that we want to fit into the technique. So, go from anchor point to anchor point. Now, because the foot's elevated, if you put a little bit of pressure through the, a varus pressure through the knee while you're taping this, you can approximate that joint line and you get your tension without having to crank it up too much on the soft tissue. So, similar to the shoulder, I've got my 3 parallels. Now I'm going to go oblique across the joint line. And I always go distal to proximal. Again, putting that pressure through the medial joint line each time. And I fan my way forward and back from that point. And I keep this probably a tighter fan than I do with any other joints, because you want it to remain taut through different parts of the range. Okay, I finish off with one down the centre. And we're going to lock that off. Above and below. Again, remember your hamstring tendons and not to apply any compressive force over them. There we go. So that's nice and neat. Now I'm going to get you standing up for us. Actually up on the bed.
Standing on the bed.
Watch your head, watch your head.
That's it? Okay. You alright?
Yeah.
Now just turn side on for us with that. Lovely. And bring that one out of the way. That's great. Okay. So the reason I get them up on the bed is because then you're working at the right height for you, which is the most important thing. Okay. So line yourself up with your lower border. Now with this, once I've been round once, I then peel up to try and cover a little bit more of the fixable, and we want to cross the medial joint line at the same point as our fulcrum is with all the others. Okay? And that's the point where you want a bit of tension. Everywhere else, you keep it nice and relaxed. And that's where this tape is really good, because it'll mould really nicely to the contours of the joint that you're working with. Now, depending on the athlete, some athletes like it a bit more fanned out, so that there's more coverage, and other athletes like it really narrowed up at the quad and at the calf. Alright, there we go. I'm going to step down. Now, does it feel overly restrictive from a walking perspective?
It just pulls here, but it doesn't feel restricted.
Good. Okay. And so ideally, it shouldn't be